Good day everyone. My name is Mary Rose Biron, BS12 from Emilio Aguinaldo College branch. I'm going to demonstrate about assessing abdomen. So, the assemble equipment and supplies. Examining light, tape measure, and let's assume that this is the water-soluble skin marking pencil and the stethoscope. So, introduce yourself and verify the client's identity. Explain to the client what you are going to do, why it is necessary, and how the client can cooperate. Good day, ma'am. I'm Mary Rose, your nurse today. What is your name?
Leticia de Bereño Bulan,
What's your age?
54.
So, how's your day today?
I'm good.
I'm going to assess your abdomen. Is that okay for you?
Yes.
So, for you to be aware, the purpose of this assessing the abdomen is so we can observe the condition of your abdomen today.
Okay.
And perform hand hygiene and observe other appropriate infection control procedures. Provide for client privacy. So, determine the client's history of the following: incidence of abdominal pain, its location, onset, sequence, and chronology, its quality, its frequency, and associated symptoms. So, ma'am, do you have any diarrhea, nausea, or naduduwal, or vomiting na nasusuka? Meron po ba kayo nararamdaman na ganun?
Wala.
Okay. Then, bowel habits. So, how's your bowel habits, ma'am? How many times na nag-eliminate po kayo?
Minsan, araw-araw na dumi. Minsan 1 week, 3 days.
Okay. Then, incidence of constipation or diarrhea. Like what she said a while ago, she doesn't have constipation or diarrhea. And change in appetite. How's your appetite? Is there any changes? May nagbago ba sa gana niyo po sa pagkain?
Wala.
Okay.
Okay.
And food intolerances. May hindi po ba kayo tinotolerate na pagkain?
Mantika lang. Mantikain.
And food ingested in the last 24 hours. Ano po yung food na na-ingest nyo last 24 hours kagabi?
Gulay.
Okay. Signs and symptoms such as nadidighay, then sumusuka po ba kayo ng dugo, or may dugo po ba sa dumi nyo, or may lumalala po ba, or what? Meron po ba kayo nararamdaman na ganon?
Wala. Normal.
Previous problems and treatments. So, sa past po, nagkaroon po ba kayo ng ulcer or gallbladder surgery?
No.
Okay, good. So, assist the client to supine position. Supine. And the arms comfortably at the sides. Place the pillow beneath the head and under the knees to reduce the abdominal muscles and avoid chilling and shivering that can cause the contraction of the abdominal muscle. So, we will proceed to the assessment. So, in assessing the abdomen, let's ask the patient if kung nakadumi ba sila or nakahihi sila, kasi pag ganun kasi, that's make the client comfortable in the assessment and make the temperature warm around the room. So, for added information, this assessment is unique unlike the others assessment kasi 'di ba sa ibang assessment is IPA method. In assessing the abdomen is IAPP, which is inspection, auscultation, palpation, and percussion. Inuuna kasi yung auscultation kaysa sa palpation and percussion kasi kasi pag inuuna yung palpation and percussion, nai-stimulate yung abdomen niya. So, magkakaroon ng false result sa auscultation. So, we will start now. So, first is the inspection of the abdomen. Inspect the abdomen for skin integrity. So, the normal findings here is unblemished skin, uniform skin, and white stretches. While the abnormal findings here is no lesions and skin glistening. There is lesion pala, then may skin glistening and purple stretch marks. Then, next is inspect the abdomen for contour and symmetry. So, we will check if the abdomen is concave or convex. That is the normal findings. While its abnormal findings is distension. Then, another abnormal findings is we will check if there is enlargement of liver and the spleen. Ma'am, can you take a deep breath, ma'am? So, the normal findings of it is there is an enlargement of the liver, while the abnormal findings is there is no enlargement. And next is observe another added information. The normal findings is symmetric in contour, and the abnormal findings on that is there is a protrusion of the umbilicus and hernias, asymmetric contour. So next is observe the abdominal movements associated with peristalsis, respirations, and aortic pulsations. So the normal findings here is symmetric movement and visible peristalsis in the very lean people, yung mga fit na people. Then, aortic pulsations in the epigastric region mostly. And the abnormal findings, hindi pala mostly, sa mga epigastric talaga. Then, abnormal findings is asymmetric movement and only marked aortic pulsations and peristalsis only visible to the not lean people. And next is observe the vascular pattern. Yung parang, yung makikita mo yung vascular sa kanila. So the normal findings is there is no visible vascular pattern. So wala naman ako nakita. And the abnormal findings is there is a visible vascular pattern. Second is the auscultation of the abdomen. So, auscultate the abdomen for bowel sounds, vascular sounds, and peritoneal friction rubs. But before we auscultate the abdomen, let's make us sure that our hands and the stethoscopes are warm. The rationale is the cold hands and the cold stethoscope will make the muscle contraction, and this contraction can have the result also to the auscultation or can be heard. So first is the bowel sounds. So there is a 4 quadrants to be followed. The right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. So the normal findings here is audible sounds, while the abnormal findings here is either the hypoactive or hyperactive sounds. The number 2 is the vascular sounds. In auscultating the vascular sounds, we will use the bell shape of the stethoscope. And we will auscultate the four arteries. The aorta, the renal artery, the iliac artery below the level of the umbilicus, and the femoral artery if needed. So the normal findings here is absence of broth, while the abnormal findings here is there is a broth of all the areas, or either just any of the areas. And the third is peritoneal friction rub. Friction rub is like the rubbing of the leathers. So friction rub. Liver and the spleen. So the normal findings here is no friction rub, while the abnormal finding here is friction rub. Let's stop mo muna, init. Next is, third is the percussion of the abdomen. So, percuss the several areas in each of the four quadrants to determine the presence of tympani and dullness. So, there is a sequence to be followed in percussing the abdomen. The normal findings here is tympani in the stomach and the dullness on the liver or the bladder and the bladder. And the abnormal findings here is large dullness. Next is the fourth is percussion of the liver. Percuss the liver to determine its size. So I already marked the size. So we will measure. Inches. Fifth is palpation of the abdomen. Perform the light palpation to detect the areas of tenderness and or guarding muscle. So we will follow the sequence of the four quadrants. The right lower quadrant, the right upper quadrant, left lower quadrant, and the left lower quadrant. Next is perform the deep palpation over all four quadrants again. Right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. So while you are doing this palpation, we can also check the facial expression of the patient and also asking if there is any problems or if there's what he or she feels on his or her abdomen. So the normal findings is there's no tenderness, while the abnormal findings there is a tenderness. And sixth is the palpation of the liver. So palpate the liver to determine the enlargement and tenderness. So 7, palpation of the bladder. Palpate the area above the pubic symphysis if the client's history indicate possible urinary retention. Additional information is urinary retention, yun yung parang feeling natin may hindi pa tayo na lalabas na eh. So, if there is any rounded or masses, there is a urinary retention. So, the normal findings is not palpable, while the abnormal findings is there is a palpable and any masses of the masses related to the urinary retention. And lastly, document the findings in the client record. Thank you.